Something strange is happening in hospitals all over the world. Doctors are encountering a mystery they can't explain, and it's leaving them baffled. Patients are showing up with no visible wounds, no history of recent injuries, and no past surgeries. Yet, when they undergo scans, the images reveal something impossible. Foreign objects lodged deep beneath their skin. What connects these seemingly random cases? One startling detail: almost every patient reports a UFO encounter. Their stories are hauntingly similar. They talk about missing time, gaps in their memory they can't account for. They describe being enveloped by brilliant, blinding lights, followed by a terrifying sense of paralysis and a sudden loss of consciousness. Days, sometimes weeks later, the physical symptoms begin. A persistent, localized pain, unusual swelling, or they discover a small, hard lump just under the surface of their skin. Worried, they seek medical help. Doctors, expecting a cyst or a splinter, order X-rays and MRI scans. The results are shocking. The scans show small, distinct objects. They're often metallic, with precise, geometric shapes. These are not random fragments. They appear perfectly formed. In many cases, the objects are surgically removed. The operating teams prepare for the usual suspect's shrapnel from an old accident, a piece of glass, or perhaps a forgotten medical pin. But what they find is anything but ordinary. The retrieved materials don't match any known medical implants or common metals. They are, for lack of a better word, alien. Laboratory analysis only deepens the mystery. Tests on these samples reveal extraordinary properties. Some are composed of non-standard alloy compositions, metals blended in ways that defy our current manufacturing capabilities. Under a microscope, their internal structures show no signs of being made with conventional tools. Even more bizarre, despite having been inside a human body for years, they show absolutely no signs of corrosion or rejection by the surrounding tissue. They look as if they were placed there yesterday. In several documented cases, the mystery takes a technological turn. The objects are found to be emitting weak but measurable electromagnetic signals. It's as if they are active, broadcasting some kind of data. What are they transmitting? And to whom? No one knows. But perhaps the most chilling cases are the ones that end without a trace. Patients are scheduled for surgery to have the object removed. They come back for final preoperative scans to pinpoint the exact location. And the object is gone, vanished. There's no scar, no sign of an exit wound, no evidence of it having migrated through the tissue. It has simply disappeared, as if it was never there. The only proof it existed are the initial X-rays. Faced with this inexplicable phenomenon, many doctors document their findings and then quietly step back. They have their medical licenses and reputations to consider. Some admit, off the record, that they've been pressured to stop their investigations, to label the cases as unexplained anomalies and move on. Many refuse to speak about it publicly at all, fearing ridicule from their peers. Of course, skeptics have their theories. They claim these are shared delusions, psychological events, or simply misidentified fragments of bone or calcified tissue. But delusions don't show up as clear. Metallic objects on an X-ray and ordinary fragments of debris don't vanish from a person's body overnight without a trace. What makes these cases so profoundly disturbing is the consistency. We're not talking about one or two isolated incidents. These reports come from different countries, from patients of all ages and backgrounds who have never met and have no knowledge of each other's stories. Yet they describe the same terrifying procedures, the same insertion points on their bodies, often behind the ear, in the nasal cavity, or in their hands and feet, and the same physical sensations. The patterns are too similar to be a coincidence. From a scientific standpoint, there is no conventional explanation. No known medical condition accounts for the spontaneous appearance of complex metallic objects inside the body. No known human technology can explain how they are inserted without leaving a scar, or how they can dematerialize on command. So what are they? Are they sophisticated monitoring devices, tracking the subject's health or location? Are they biological trackers, collecting genetic data for some unknown purpose? Or are they something else entirely, something beyond our comprehension? Modern science, for all its advancements, has no answer. All that remains are the ghostly images on the scans, the strange, unearthly fragments preserved in lab jars, and the one terrifying, unanswered question that echoes in the silence. If these implants are not made by humans, then who put them there? And why? The implications are staggering. It suggests that someone or something is conducting systematic, clandestine experiments on human beings, using technology far beyond our own. And if that's true, it means we are not alone. And we are certainly not in control. Thank you for watching. If you found this story as unsettling as I did, hit that like button and subscribe for more explorations into the unknown. What do you think is going on? Let me know your theories in the comments below. Stay curious and stay safe.